Welcome to Evergreen Family Medicine. Today we're talking to Dr. Liz Oler with Evergreen Women's Health. Welcome not only to the YouTube channel, but welcome to Roseburg.
Thank you.
Tell us about where you were and how you came here.
So I have come by way of many different places prior to this, but I most recently was in Seattle and moved to the Pacific Northwest a little over a year ago, fell in love with this area, and now never want to leave.
We love stories like that, because we obviously love this place. So it's wonderful to hear that from you. And you've landed in a fairly unique situation. Talk about Evergreen Women's Health, the way this whole organization is built, and what makes it so special.
So I was very impressed when I came for the first time and heard about the structure of what this job would be and how the partnership would evolve over time. I was very impressed by the fact that there's a lot of expansion in the future for our practice, and also that Dr. Powell is a wonderful person to work with. Both Dr. Tim and Dr. Mary are wonderful people to work with. And I really liked the fact that this practice, compared to other OBGYN practices that I looked into, is very integrated with the family medicine model. So the preventive model, it's a lot more emphasis on long-term health and kind of optimizing outcomes from the preventive side of things, rather than just coming in as a specialist, which we do as OBGYNs. We come in and fix specific problems in our area, but we also are treating women for long-term health conditions and also just long-term health needs. So things like menstrual health and sexual health that they may not be comfortable discussing with another primary care provider. But those are things that affect women's health in the sort of broad sense. And so we like to approach them as preventive medicine topics.
A couple of the things that we've talked about around Evergreen Women's Health that make it unique are the wide range of services that you provide. This isn't a narrow, like you said, it's not a specialist situation. Talk about the services that are available.
Absolutely. So being integrated with a family medicine practice means that we are seeing women primarily for gynecologic issues. So we encourage people to have their primary care doctor managing the majority of what they need in their long-term health plan. But we're here specifically to address issues that I was describing, like sexual health. Not a lot of doctors are comfortable talking about sexual health with their patients, and we can be a place where women can come and have those more uncomfortable conversations. And same thing with menstrual issues or long-term chronic pelvic pain is a very common issue that we treat that requires a little bit more nuance as far as, imaging studies, lab testing, also just general management and medical treatment that we can do. And then ultimately what we can offer that a family practice doctor can't is surgical interventions. So if a patient needs to have a DNC or needs to have a hysterectomy or just needs to have some kind of diagnostic procedure to see what's going on, we have the ability to offer that service within the context of the more family medicine model.
Can you also talk about the age of the women that you're able to serve? Because that's also a wide range, pretty wide open, right?
Yeah, the whole lifespan. So that's another nice thing about our practice is that we treat women from essentially when they begin having sexual intercourse. And so that's sort of the earliest that we'll see. But also we see young girls who may have late puberty, or we also will see young girls who have pelvic pain or other concerns. But really our primary age group is from childbearing years until the early to several years after menopause, when we may be managing things like hormone treatment for menopausal symptoms. Once women reach 65 to 70, there are fewer indications for coming to see the gynecologist, but certainly we are a resource for the Evergreen family medicine providers if they are uncomfortable doing a pelvic exam or a breast exam, or if there is a concern, a specific issue like vaginal discharge or issues with pain, anything like that might be slightly more specialized than the family medicine provider is comfortable with.
And another thing that I hear about with Evergreen Women's Health is how important relationship and trust is. And so you develop that over time by being able to stay with the same doctors that you're used to visiting.
Absolutely. We love that in our practice. And similar to a more family medicine, preventive medicine model, one of the things that's great about our specialty is that we can take care of women over the entire lifespan. Of course, pregnancy and childbirth is a time that we see them a lot more frequently and have a lot more interaction, but that relationship doesn't have to end with the end of pregnancy. So.
Well, it's a pleasure to get to know you a little bit and to welcome you to Roseburg. But I forgot to sort of ask you a little bit more about your background and your passion for everything that we've been talking about today.
Well, hopefully I seem passionate. I love what I do. But yeah, no, of course, I love my job. I love my coworkers. I think one of the things that really drew me to this practice was how wonderful the people are here. And so as far as my background is concerned, I came from the East Coast, so all of my family's still out there. They're a little bit curious as to why I found myself in a small town in Oregon, but they visited already and loved it here. A lot of things about this community were really appealing. The weather's amazing. The landscape is beautiful. So there were several things. My husband also really, really liked it a lot, and we like the idea of kind of settling down in a smaller town rather than staying in a stressful big city forever. So, but yeah, I did my training on the East Coast. I did my medical school on the East Coast, but I do have family and friends out here as well. So
yeah, as long as your family doesn't say Oregon. Oh. You have to teach them that first.
I definitely primed them before they got here. My mom, I'm not sure. I have to think back. She might have messed it up a few times, but she tends to just...
It's a learning thing.
Yeah, exactly.
So, well, Dr. Liz Oler with Evergreen Women's Health, thank you very much for your time.
Thank you for your time. Thank you.
You can find out more about all the fantastic and highly qualified and passionate doctors and providers that we have at Evergreen Family Medicine online at evergreenfamilymedicine.com. You can also follow us on YouTube, Facebook, Twitter, and Instagram.